Hello. I welcome you to my channel. My name is Dr.RAYLEE, and this will be our first question and answer session ever starting this year. And the question of course are not cancerous cells. A fibroid is a benign tumor and will not turn into cancer. They come in different sizes, can be single or multiple times, and in different locations in the uterus. Secondly, every woman is at risk of getting fibroid, but some have higher risks than others. And then also, not every woman will have a fibroid or fibroid in their lifetime. Now, the reason every woman is at risk of a uterine myoma or fibroid is because of the hormone called estrogen. Estrogen is the dominant hormone in females, and although the exact cause of these conditions are unknown, the most underlying factor for a uterine myoma or fibroid is estrogen dominance. It simply means an excessive production of estrogen beyond the normal. Now, of course, there are some other factors, but this is the major culprit or underlying factor. So most women who develop a fibroid has an estrogen dominance problem, and if they choose to go under the knife by the advice of a doctor, that is, if you have fibroids, remove the medical term is called myomectomy. And myomectomy is great, but it doesn't stop or prevent you from having the fibroid again unless you opt for another surgical procedure called hysterectomy, where the uterus, the womb is entirely or totally removed. In that case, you won't have any problem with uterine fibroids. But most women don't like this type of procedure called hysterectomy. Either they still want to have children or a jet doesn't sit well with them, having a part of them removed. And so the reason certain women experience new growth or reoccurrence of fibroid or fibroids after removing the existing one is because what most of the times we fail to understand is that of the risk factors. What brought about the estrogen dominance in the first place that made you have the fibroid in the first place? Most doctors don't talk about it because they assume the causes estrogen dominance, because if you experience a real growth of fibroid after you got them removed, then chances are you are still in that state of estrogen dominance that brought about the uterine fibroid in the first place. This is why a woman and so, sorry about that. So, this is why a woman, when she reaches menopause or postmenopausal stage, if they had their uterine fiber removed, either it shrinks by itself, it doesn't get bigger, or it remains the same because estrogen as they age in life. So, in conclusion, why do certain women experience real growth of fibroid after they are still in the stage or that state of estrogen dominance, and that might trigger new growth? And if you want to know the other causes or risk factors for uterine fibroid or myoma and to treat it naturally without surgery, I'll put the videos down in the